Hi everybody, I'm Dr. John Douillard, and today I want to talk to you about a very interesting topic. It's when you close your mouth at night, it has a powerful effect on your oral hygiene. And in fact, there are a handful of studies that show that when you actually mouth breathe at night, and a lot of us don't know we're doing that, it's actually directly linked to cavities and a host of other concerns that I want to talk about. When you open your mouth at night, your mouth will dry out. When it dries out, opportunistic bacteria begin to proliferate inside of your mouth and cause all kinds of problems, from bad breath, from their waste product called volatile sulfur compounds that cause bad breath, to a proliferation like 4 times the proliferation of a really dangerous bug called Streptococcus mutans, which has been linked to the plaque in your heart and your arteries. About 64% of the folks who have arterial plaque, it comes from the mouth. The same bacteria that causes the plaque in the mouth and your teeth causes the plaque in your heart, and about 64% of the time. And also the same plaque that causes plaque in your brain is linked to this same bug, right? So your mouth matters, right? Really matters, really importantly. So interestingly, a patient of mine, a long-term patient of mine, friend of mine actually, over the years, wrote me an email telling me what happened to him when he closed his mouth and breathed through his nose for a period of time. And this is what happened. I thought this was quite profound. He said, I started on this journey with you to tape my mouth 18 months ago. I started because I called frustrated with a lifetime of cavities, and I was just told that I had 9 more cavities. And again, more cavities. Since then, mouth taping has become a non-negotiable part of my life. I use a simple light tape that costs about $2 and lasts for months. I only use a small postage stamp size, and it's always there in the morning. Just a little bit of tape right here, just right across your lips. You can go from up in here all the way down to here if you like, but just enough to close. You can still breathe through the sides. We're not duct taping your entire mouth. But here's what happened. So today, I went back to the dentist for my first cleaning and checkup since starting mouth taping. I was told I had 0 cavities, maybe for the first time in my life. She also said, I can tell mouth breathers by their gums. You have none of the signs of a mouth breather. Mouth taping may seem strange, but it clearly works. And I wrote an article a while ago, a couple of years back, about mouth taping. It was called something like 20 scientific reasons why you should mouth tape at night, which is really important. And you can go to that article. You can also, this article, which is mouth breathers, about the cavities and things, that's up on my website. It's right on the first homepage at LifeSpa.com. So check that out. Pretty cool story about a lot of the research. So, you know, there's a lot of reasons why we should close our mouth at night. You know, historically, Native Americans, they were all trained as young kids to breathe through their mouth, through their nose when they sleep at night, tuck their chin. When I was in India doing my first research on my book, Body, Mind, and Sport, about nose breathing versus mouth breathing and exercise, I kept stumbling upon all these studies talking about nose breathing was such a critical part of raising children, teach them how to breathe properly when they're young in the crib and so on, so they actually become nose breathers. And there's all kinds of benefits, and one of them really critically important now is COVID. You know, we walk around talking to people, you know, in our normal life, maybe not the COVID life, but we walk around talking to people and we're exposed to all kinds of things, from the food we eat, the air we breathe, and all that. Then you go to bed at night and you close your mouth, supposed to, and breathe through your nose. In the paranasal sinuses here, you produce a gas called nitric oxide, one of the most powerful antiviral gases the body musters and makes. And when you breathe through your nose, you make 100% of this antiviral gas. When you breathe through your mouth at night, you make 0. So when you close your mouth at night, that gas is now being washed over all of your respiratory tissues and disinfecting all the bugs and debris and things that you may have ingested or inhaled during the day. It's sort of nature's way of defending you, because we know walking around you're going to be exposed to dust and all these things. Absolutely, you know, well-known fact. But then when you breathe through your nose, that nitric oxide, Nobel Prize winning gas, washes through the respiratory tract and gives you that disinfectant benefit. So really, really important from that perspective. But when you do open your mouth, you change the bacteria, you change the environment, and that's been linked to a host of things, including bad breath, It's been linked to dental cavities, gingivitis, dental plaque, snoring, allergies, asthma, sleep apnea, arterial plaque, heart health, brain plaque, and cognitive decline. And that's for adults. Now, for younger kids, when they're developing, it's so important because the tongue, when you close your mouth, the tongue gets pushed against the airways, the palate, and it widens the palate and opens up the airway. And if a kid has their mouth open and they're snoring, the airway literally shrinks by 50%, and it forces the kid to open his mouth like that and then to try to get some air during the night, and they become mouth breathers and snorers, and that's linked to all the things that I just mentioned. So kind of a really important kind of concept. I thought it was a great story. If you have cavities, your kids are looking at cavities, and also I wrote an article called "Is Your Face Too Small for Your Teeth?" for your wisdom teeth. This is the reason in kids in development ages why they have to have their wisdom teeth pulled, which never happened before with humans until we started not chewing, eating soft food, and we don't chew like we did to really widen the palate, and therefore when the jaw is not strong enough to close itself at night, you end up opening your mouth, and that changes your airways, changes how you breathe, changes the bugs in your mouth, changes therefore the bugs in your gut, right? Because whatever you have in your mouth, you swallow, and they become your gut bacteria as well. So really, really important stuff. Check it out, super simple. Just a little tiny piece of tape right there, and you don't know. I ask all my patients, do you sleep with your mouth open or closed? And they always say, I sleep with my mouth closed. I'm sure I do. And they have no idea because they're asleep. So the right answer is, I don't know, I'm asleep. And I asked about an 8-year-old if they did that the other day, and she said, I don't know, I'm asleep. And I was like, God, finally I get the right answer. That is the right answer. So the only way you know is put a little piece of tape there and see if that's, in the next room, stuck to the wall, somewhere in your sheets, when you wake up in the morning, or is just sitting there like it was when you put it there. That's how you know. And if you have it, if you're a nose breather, God bless you. And I highly encourage a book that talks a lot about this. I've written a lot of articles about this, but James Nestor wrote a book called Breath. It's a bestseller, New York Times bestseller right now. And he has a technique where you actually take your finger of your kids and feel this hard palate. And if it's flat on top, you're in good shape. But if it's pointed like that, then you have an issue. Particularly with your kids, you want to start thinking about things to do to kind of get that palate to flatten out and widen and open up those airways. And read that article that I wrote called "Is Your Face Too Small for Your Wisdom Teeth?" Because when you have young kids, it's critically important to know now before, when they're 18, everybody just gets all their teeth pulled because they're 18 and they're humans. That's just never been the way it was, and it surely is not the way it should be. And a lot of new research is now coming out called functional orthodontics, which is actually preventing this from happening by creating facial structure that can support the teeth we were designed to have. All right, thanks for listening. See you next week. I'm Dr. Douillard.